This is Dr. John Wycoff of the Wycoff Wellness Center in East Lansing, and we're going to talk today about a topic that is at the heart and soul of Wycoff Wellness, and that's bioidentical hormone replacement. So I'm going to give you a primer today about bioidentical hormones, what they are, a little bit about hormone replacement in general for men and women. You know, sometimes we get caught up with hormones, and we think this is strictly a female issue. The reality is hormone decline occurs in both men and women as we get into mid-age. And, you know, conventional wisdom, what I was taught in medical school, I'm a very conventionally trained board-certified family physician who practices functional medicine, is that as you get older, your hormone levels decline. That is just what we're taught. And we believe that in our heart and soul. It's kind of beaten into you. So when we see women who are menopausal or men that are in their 40s or 50s and they've got symptoms of hormonal decline, we just say, well, that's normal. We measure the test and say, well, yeah, you're low because you're menopausal. Well, if you look at that equation just a little different, and instead of saying as we get older, our hormone levels decline, if we said, well, as we age, hormone levels decline. The reason we age is because declining hormones. Well, if that is somewhat true, then you could say, well, if we maintain our hormonal level, will we slow down aging? And that's really where functional medicine difference or parts ways with conventional medicines. We believe that you can replace hormones to a normal physiologic level of maybe a 35 or 40-year-old male or female and optimize health. So if we can replace hormone levels and maintain hormone levels, there's ways to do that even without medication. If we can optimize hormone levels, can we slow down the aging process? And that's really a big part of what we're about at Wycoff Wellness. So the first step in, doing a hormone replacement is to think about it. For women, it's pretty straightforward. If you're having hot flashes or night sweats and your menses have stopped, you're probably entering menopause. Okay, pretty straightforward. But maybe you're still having cycles, or they're irregular, or you're a guy and you're having symptoms like insomnia. You're having trouble concentrating. You have fatigue. You just don't feel well. You're apathetic. Maybe you're depressed. You're more anxious. Oftentimes, hormone decline, hormone imbalance is part of that equation. So when you see someone like me who looks at the whole person in an integrative way, we would look at hormones quickly as one of the potential areas that we needed to address to determine your problems. We would do the right testing. The testing could be blood testing, simple to do. We may want to do saliva testing. We can do urine testing. I do primarily saliva testing in women that are premenopausal especially, but it can help with men and also in women of any age. Saliva testing tells us what's going on inside of the cell. So when we do a blood test, we're kind of assuming that the serum is equating with what's going on in the blood. And sometimes that's true, but it may or may not be always. Saliva gives us a measure of what's going on inside the cell. We're looking at a product of the salivary gland. The hormone levels, we can measure them all inside the what happened inside the cell. Really what matters to you, what goes on inside the cell, not what goes on in the plasma or the bloodstream. It's what's in the cell that matters. So saliva testing allows us to get that testing. It also allows us to more accurately measure adrenal gland function. Adrenal glands are your stress glands. They're located above your kidneys. You've got a pair of them about the size of a walnut. And as we get older, especially if we've had a lot of physical stresses, mental stressors in our lives, our adrenal glands become depleted. You begin to suffer from adrenal fatigue. So we get a 4 sample during the day, morning, noon, afternoon, evening of saliva. You just spit into a little tube, and we submit it to a lab called ZRT Laboratories. I encourage you to get on their website, ZRT Laboratories. Learn more about saliva testing. So the first part of determining hormonal imbalance is to get the right testing. We'll talk about that with you at your initial appointment, and we'll get the blood testing or saliva testing or urine testing, whatever we feel we need to get you on get a diagnosis made. So let's say that we've done the testing, we've done your history, we've done your physical, and the testing shows that your hormones are out of balance and you want to get them back into balance. How would we do that? It's a great question. We would look at your lifestyle. We try to get your diet and exercise habits optimal. In my opinion, what does that mean? Well, in terms of diet, we really embrace a type of eating called the Mediterranean diet. And you may have heard of this. You can Google it. Lots of books on it, lots of information on the internet. Mediterranean diet is primarily plant-based, and it's high in foods that have healthy oils. Things like avocados, nuts, seeds, sardines, fish. Those types of foods have healthy omega-3 fish oils and healthy oils in them. They are the most common deficient type food we have on the American diet. So eating like they do in the Mediterranean with olive oil, getting away from the seed oils. The seed oils are poison. Grapeseed oil, safflower seed oil, corn oil really need to be eliminated from your pantry completely. Use olive oil, avocado oil, use non-seed oils in your baking and cooking. Simple things you can do to reduce a lot of the oxidative stress you're putting into your body. Eating fresh fruit and vegetables, we'll be talking about that through all of our podcasts, and controlling your stress and getting modest exercise. What is modest exercise? It means getting on your walking shoes and moving. You don't have to do more than that. Just get out and walk 20 minutes a day, 30 minutes a day, depending on your level of conditioning. But if you've been sedentary, start walking. Just walk around the block once. Walk to the driveway back and forth a few times. Just get up and move your body. You can certainly go to the gym, get a treadmill, lots of ways to get exercise. You can work with a trainer. Those are all great options, but you've got to move. The other thing I see with people who are trying to balance hormones is not drinking enough water. We don't drink enough water. You can take your body weight, cut it in half, and that's how many ounces of water you need per day. So if you're a 150-pound frame person, you need 75 ounces of water. That's about 3 quarts. So 2 to 3 quarts of water per day. If you're a 200-pound person, you need upwards of 3 to 4 quarts, upwards of a gallon of water per day to maintain hydration. Very critical. Very few of us get enough water in our daily routine. I try to drink it all day. I've got some water here at my desk for the show, and I like to start the day with a full glass of water with some minerals. We'll talk more about that too. You need to hydrate and replace water that you're losing throughout the day. So lifestyle, controlling your diet, optimizing exercise, controlling your stress, getting adequate sleep, getting in a good pattern of sleep. We revitalize our hormones during sleep. So if you're not getting good sleep, let's talk about why that is. Maybe it's because your hormones are off. Maybe it's because you've got too much on your plate. Certainly we all have stresses in our lives. We've got a marriage, and anytime marriage is always stressful. I don't care how good it is. You have kids. Kids are stressful. Kids are great when they're babies, but they become teenagers. Oh my gosh, you pull your hair out. I used to have hair when I had kids, but as you can see now, it's all gone. So, stress is a big deal, and you're going to have stress no matter what. But learning how to effectively deal with stress is really one of the secrets of longevity. And there are people that can help you do that. There are books, there are resources, and there can be reasons why you're reacting in a more stressful way, such as hormone imbalance, methylation issues, nutrient deficiencies. We'll talk about that today and through all of our podcasts. But let's say we got to the point where we've gone through those parts of your treatment program, your diet, lifestyle, and we've got you on some basic supplements, things that I recommend, a good methylated multivitamin like Phytomulti from Metagenics, omega-3 fish oil like our Omegagenics EPA DHA 720, and vitamin D3, usually for an adult 5,000 I use per day. I always recommend you talk with your healthcare provider, your family doctor, or whoever you see, and discuss supplements with them. Have them monitor you appropriately. You certainly can do vitamin D levels. One of the most important tests you can do is a vitamin D level. I do them twice a year myself, and do them almost on all new patients initially. But get the foundation of getting healthy and making healthy hormones. You can't make healthy hormones if you don't have a foundation. The foundation is based on your diet, controlling stresses and getting adequate sleep, and taking some nutritional support. We have all of that at our office at Wycoff Wellness or on our website at wycoffwellness.com. Feel free to stop by our office in East Lansing or contact our office or get on our website at wycoffwellness.com. So we've mainly made a decision to look at bioidentical hormone replacement. So why does Dr. Wycoff use bioidentical hormones versus conventional hormones? I sometimes call those the counterfeit or the synthetic hormones. We'll delve into that a little bit more. Bioidentical hormones are hormones that are manufactured and chemically identical to hormones produced by your body. So if we replace estrogen, we're doing it with a form that is biologically, chemically identical. Why is that important? Your body will recognize it immediately and will process it through the same pathways of metabolism that it did when your body made estrogen. So if you're 55 and you've gone through menopause, your ovaries are not making as much estrogen as they were when you were 35. We start you on some form of hormone replacement. If we use bioidentical hormones, your body will recognize them right away and will metabolize them in the same pathway that it did when your ovaries made the estrogen. Same with progesterone, testosterone. Bioidentical hormones are FDA approved. They're available with prescription. So we have ours compounded by a compounding pharmacy, a pharmacist that takes the raw ingredients, puts them in the amount that I have determined appropriate for you and in the form that we've requested, and dispenses it to you. We can custom mix our bioidentical hormone replacements in all kinds of forms. We can do capsule forms. We can do cream forms. We can do under-the-tongue tablets. We can do what are called buccal troches, like a communion host that sits between your gum and your cheek. We can do injectable forms. There are hormone replacement with pellets. We don't really advocate using those, but lots of ways that you can replace hormones, and we can adjust the dose based on your needs, your symptoms, and to get you to be optimal in terms of your hormone replacement. We'll monitor that with the appropriate testing, maybe further follow-up blood testing or saliva testing, and try to get you to the optimal dose, the normal physiologic dose. We're not trying to make you super physiologic. I'm not trying to get you so you can hit a baseball out of the stadium day after day. I don't want you at that point. That creates a whole another group of health issues. But we're going to try to get your hormone levels maybe like they were in your 30s, when you probably felt good. You didn't have chronic disease. You had passion for life. You had energy. You had good sleep. You can control your weight. The inability to control weight, especially weight around your abdomen, is oftentimes related to hormone imbalance. So we use bioidentical hormones. These are chemically identical to natural hormones produced by the body, include estrogen, progesterone, testosterone, but we also can get adrenal hormones that are bioidentical. They're used primarily to restore hormonal imbalance and reduce some of the symptoms like hot flashes, night sweats, vaginal dryness in women, but oftentimes anxiety, depression, sleep disorders, and even help with weight management. These are FDA-approved hormones, and they're available in a variety of compounded forms like we talked about earlier. They're safe and effective, and I think there is evidence to support that bioidentical hormones have benefits over conventional hormones. A lot of people get concerned about hormone replacement, especially women, because they've heard all the bad things. And the studies that were done on hormones that showed adverse effects were done on the synthetic or counterfeit hormones like Provera, Premarin. Premarin is derived from pregnant mare's urine, hence the name Premarin, pregnant mare's urine. Premarin was made by a pharmaceutical company in the United States, and they commissioned a study, this pharmaceutical company. They were so convinced that their medication was safe that they commissioned a long-term study, multi-year study, looking at the safety and efficacy of Premarin. Well, the study had to be halted after just a couple of years because the FDA, who was overseeing the study, saw that an alarming increase in the incidence of heart disease, stroke, cancer, blood clots in individuals that were taking the synthetic hormones. It was alarming. Those of us in my world knew that this drug was a problem. And at that point in time, this was the number one drug prescribed in the world, Premarin. It's still available on the market, although the study really caused clinicians a pause in prescribing Premarin. It has dropped from the number one position, if you can believe it, to the number 7 position of frequently prescribed medications in the world. It's still used. It's a multi-million-dollar drug. Yet it's not considered to be really safe. About a 200% increase in blood clots, about a 25 to 30% increase in fatal heart attack, stroke, breast cancer. So Premarin and Provera, which were the mainstay of hormone replacement for women, have really gone through a revolution. And some doctors just will not prescribe it. They just feel it's unsafe in any form. We feel that bioidentical hormones can be prescribed safely and effectively for women and men with the appropriate diagnostic testing and monitoring and in the appropriate form. And that's what we do at Wycoff Wellness in East Lansing, is we do the right testing. We get you on a comprehensive integrative program to maintain your hormonal balance. We may get you on some supplements like we talked about, but there are some other specific supplements that help maintain hormonal balance. Natural plant-based supplements that can really be of help to you. So I think if you're looking at hormone replacement, you want to find someone like me in East Lansing, or someone that will use bioidentical hormones. Discuss that with your healthcare provider. Have them consider your history, your preferences, how to best get you to that point where you're feeling better. Looking not only at hot flashes and night sweats, but how you're sleeping, what is your energy like, what is your cognitive function, how are you able to build muscle, are you feeling like you're on a road to vitality? Because that's what you deserve, and that's what you should be, even in your 50s, 60s, and 70s. I have women and in my practice who are well into their 80s, who look like they're 50, who have friends who just refuse to consider hormone replacement, yet they're vibrant, their skin is healthy, and the benefits of hormone replacement go beyond hot flashes and night sweats. They have been shown to consistently cause stronger bones, reduce bone loss, osteoporosis, improve heart health, reduce risk of heart attack, most likely reduce dementia. So less dementia in people that take hormone replacement therapy. And oftentimes I get patients who are on replacement and they'll say, well, Dr. Wycoff, I feel great. How long should I stay on my hormones? And I tell them it's really easy. I said they can decide. When they get tired of feeling well, they should stop. And then they smile at me and they say, well, like never? I said, well, if you never want to get tired of feeling great, you should keep taking them. Keep coming in to see me. Let us monitor them. We can do the health monitoring you need. Your primary care doctor and gynecologist can do that. For men and women, you can see your primary doctor, get your prostate testing and cholesterol and blood testing. You can be monitored and you can stay on hormone replacement as long as you feel comfortable taking it. So that's the curt answer for how long do I keep taking hormone replacement. I think that there are just tremendous advantages long-term. I think with any therapy, there's always risk. There's risk in almost everything we do. You mitigate the risk by working with an individual who understands bioidentical hormones, understands the difference between bioidentical hormones and conventional synthetic hormones, and knows how to pick the right dose and the right delivery system for you, and can help you get that individualized approach, which we practice at Wycoff Wellness, and we try to do that each and every day with each patient that we serve, is to get them on that path to health and wellness naturally. So find someone that can get you on that path to hormonal balance, hormonal replacement, can get estrogen, progesterone level balanced out. Even if you're premenopausal, oftentimes all premenopausal women need is some progesterone. I've had many women who use progesterone cream during their cycle, maybe a few weeks out of each cycle. And I had one really nice lady who daughter was a doctor, or told her mommy when she was a little irritable, say, "Mommy, would you get some of Dr. Wycoff's Happy Cream and put that on, please?" Because she became a different person when she did her progesterone. So oftentimes the consequences of hormonal imbalance you may not appreciate. You may be a little bit short-tempered with your loved ones. You may not have the patience. You may be forgetful. You may not be on your A game. We want you to be optimal in your health. It means getting your optimal levels, getting you to the point where you can have energy, sleep well, not worry, not have anxiety or depression. You can accomplish it if someone can get you on that path, the integrative functional medicine path, like we do at Wycoff Wellness. So get on that path to wellness today. Get healthy, get well, and if we can help you at Wycoff Wellness in East Lansing, please let us know.